Chris Garrity here today to talk to you all about complex post-traumatic stress disorder, or CPTSD for short. And many of you wrote me after my last podcast on PTSD saying, hey, I have a friend or family member with this diagnosis, but I don't see a lot of the signs or symptoms that you told me about. And the answer to that may very well be that they have CPTSD. And CPTSD can be very unique and quite different from PTSD, nonetheless very destabilizing and difficult to treat. So today we are going to take a closer look at CPTSD. We're going to take a look at some of the unique causes of it, and most importantly, how we can be agents of change in someone's life who suffers from it. So join me here today as we do a deep dive into complex post-traumatic stress disorder. So let's take a look at complex post-traumatic stress disorder. So like PTSD, it definitely results from trauma, but the key differentiator here is that the trauma tends to be repeated or prolonged in some way. So you may think of the conventional post-traumatic stress disorder as someone goes to war, experiences a profound event, and then is shaped by that event for many years or the rest of their life. And complex post-traumatic stress disorder, it's often repeated trauma over many months or many years, such as repeated childhood abuse, neglect, or captivity, or even suffering from complex psychiatric disorders other than PTSD that cause a lot of stigma or affect their ability to socially integrate. So like the core PTSD symptoms, many people with complex PTSD re-experience the traumatic events. They have profound avoidance or isolation type behavior. They can become very isolative, shut down, not engage with the world as a result of their trauma. And, like classic PTSD, they have a lot of the hyperarousal, hypervigilance, always on guard. But there are some very key differences as well. And the disturbances that are present in complex PTSD that we don't always see in PTSD include a big emotional dysregulation piece. Emotional dysregulation can take many forms. Somebody can feel like life is going very well at a certain point in their day, and then profound distress or negativity as quickly as the wind changes. And a lot of people with CPTSD will consistently describe highs and lows throughout their day. And this will also be accompanied by a negative self-concept. They are not good enough. They are not secure in their identity. And lots of times that security in their identity is a key differentiator. A lot of people with complex PTSD have identity disturbances. They don't know who they are. They feel empty inside. They may feel like they don't have an identity in ways that other people do. So let's take a deep dive into the mood lability piece of complex PTSD and how it stacks up against PTSD. So with classic PTSD, it's much more stimulus triggered. There's fear or anxiety. There are episodes tied to reminders of the trauma. And CPTSD, like we just talked about, we see a lot of rapid mood shifts throughout the day. We see that these mood shifts are not necessarily tied to clear external triggers. It's very common for people with CPTSD and friends and family to not even understand why people with complex post-traumatic stress disorder experience these mood swings, because nothing seems to be going wrong in their day, or they don't seem to be reacting to anything in particular. And internally, many of them are fighting a war, almost a proverbial tug of war between mastering the trauma that they have suffered for many years and being victim to it. And when they are victim to it, their mood shifts frequently. They are at risk of experiencing the destabilizing features of the trauma in a unique way. Some of these intense mood swings can be shame, anger, emptiness, anxiety, and really all features of emotional regulation impairment. And that's really key here, is emotional regulation is, in my opinion, much more pronounced in CPTSD than in PTSD. So let's look at more of the common causes. And I can't stress enough here that the causes of CPTSD are incredibly diverse. The importance is the longitudinal connection, is that these causes are usually chronic. They are often taking place over many years, can be situational, but can also be the result of, other psychiatric conditions. But let's look at chronic interpersonal trauma. Often that's emotional neglect, lack of attunement or validation from people in their life. Chronic emotional abuse, criticism, humiliation, inconsistent caregiving is a big one. Sometimes when a parent is not around, a child has to learn to be the parent, or maybe even to provide in ways that they weren't accustomed to. This all creates a lot of dysregulation. But I'd like to focus next on some of the causes I see in my practice that have less to do with less to do with specific environmental triggers, but more to do with other disorders that have shaped them. So the very top sentence, trauma can be lived via chronic misattunement, is very true for complex post-traumatic stress disorder. And think about what misattunement really means, is that in someone who has experienced or continues to experience chronic trauma, they don't have the ability to stay attuned to their basic needs. The trauma puts them on defensive footing always. It rapidly degrades a sense of self-confidence and a sense of control that people without trauma in their lives naturally develop in the course of their formative years. And you can quite certainly imagine how this sense of chronic misattunement leads to identity erosion. So let's take a look at some psychiatric disorders that do this very well. So for instance, autism spectrum disorder. As you may have learned about autism in my first podcast, it's all about sensory overload or social confusion. Bullying, exclusion, and exclusion are big parts of this. When a person is consistently misunderstood by the world consistently feels unsafe and unpredictable. And that person remains very hypervigilant when they are forced to live in a world that they simply don't trust, or they simply can't live inside of in a way that instills confidence. So as a result, complex PTSD can develop over time, and that person can develop very intense maladaptive coping techniques such as shutting down, becoming isolative, becoming very reactionary in a way that they may not have ever, in a way that they wouldn't have otherwise. Another disorder that can actually do this is ADHD. People with really bad ADHD that is never treated often experience chronic criticism or repeated failure, especially if someone has lofty goals in life and is otherwise very intelligent because, intelligence and ADHD have nothing to do with each other. They may feel profoundly disenfranchised. They may feel like they live in a world where they are not performing, but they don't know why they're not performing, and they have a lot of internalized shame. And that internalized shame creates the structure for CPTSD to form and can very profoundly erode someone's sense of identity and also create the same type of maladaptive coping mechanisms that we've previously talked about, including isolation. And to a lesser extent, we see this in other contributors, such as anxiety disorders, depression, and caregivers of people with profound psychiatric illness over time can, develop CPTSD in many of the same ways. So what does this trauma do to somebody with CPTSD that it, doesn't always do with PTSD? And CPTSD is really unique in that the cumulative trauma tends to fragment a person's identity. They often say, I feel empty inside. I feel a void. I have an unstable sense of my self-image. I don't know who I am. And that also translates into a profound difficulty maintaining consistent relationships or roles in people's lives and being present. Presence in everyday life becomes that much harder. Showing up for work becomes that much harder. And internalized trauma narratives shape identity. Oftentimes they are, in some subconscious capacity, replaying their compounded trauma in their heads, and it ends up crafting an alternate identity in many ways, or simply just destroying their original identity and turning them into really someone who is fractured or feels fractured in who they are as a person. So let's look at how we treat CPTSD. And as you may notice, it's very similar in ways that we treat PTSD. But the key differentiator here is that CPTSD often responds very well to dialectical behavioral therapy, or DBT for short. And dialectical behavioral therapy is all about emotional regulation. How do people learn to radically accept their trauma in a way that doesn't destroy them? And that is a very difficult process, but it's a necessary one for CPTSD. So lots of people with CPTSD will do a lot of homework in DBT workbooks that teach grounding techniques and self-regulation and what we like to call radical acceptance. And just like in regular PTSD, oftentimes we will use medications such as SSRIs, like Zoloft or Prozac, to treat many of the physical symptoms of CPTSD, especially if there's co-occurring anxiety or depression. Those can be major factors that inhibit the quality of life of someone with CPTSD. Lastly, we're going to talk about what living with someone with CPTSD is like and how we can help them. The first point is that we need to prioritize emotional safety over being right. So what do we mean by that? So basically, your goal is to reduce threats and help regulation, not to win an argument. A lot of times people with complex post-traumatic stress disorder will take things in the wrong way. They will, for lack of a better term, seem to attack other people when they feel like they are being invalidated or backed into a corner. They oftentimes will make up facts, statements or facts. And that can be very hurtful to loved ones, especially when the loved one has a very different version of events that has happened. For instance, somebody with CPTSD may be triggered in a way because of a set of circumstances that invalidates them and makes them feel, rejected, and they may actually ascribe intent to someone in their family in a way that is simply not there. For instance, my mom went out of her way to cause this to happen to me, or my dad created a condition that made me feel unsafe, even though that condition has nothing to do with any conscious effort on their parents whatsoever. So instead of contesting these types of attacks or assertions from someone with CPTSD, it's important that you recognize that somebody who is doing this is in a severe threat state, and that logical reasoning drops offline, and that tone and perceived intent matter more than accuracy. So even if something factually did not happen the way they describe it, correcting them in the moment can be very destabilizing. So one thing, one statement a loved one can make is that instead of saying, son, this is not what happened at all, let me explain the facts. Instead, they can say, I can see this really upsets you. I can see that this felt hurtful to you. Or something along the lines of, I'm here with you and we can slow this down. Notice that none of those statements take a stance. They don't infringe upon the person with PTSD's perception of their own internal lived experience. And that's very important, is that somebody with CPTSD has a very real internal experience, and anything that a family member says that can invalidate that can lead to a very rapid de-escalation or an intense argument. So clearly being supportive and describing how impacted the person is, such as, I can see this really upsets you, or you seem really hurt, goes a long ways to validate their internal experience and de-escalate tension. Another great piece of advice is that when we validate feelings, we don't always want to go into an immediate problem-solving mode. Sometimes going into an immediate problem-solving mode can be emotional overload. A lot of times people with CPTSD know that they have a problem to solve, but can't go about it in a productive way. So if they feel forced into trying to solve that problem, it can serve them, it can destabilize them and create more internal friction in the family. Next would be consistent and predictable in communication. Predictability is key, because remember, people with CPTSD often feel like they live in an unpredictable world. So if you can create any consistency to their lived experience in the form of predictable communication, that actually can have a very calming effect. The next one can be very difficult, and that's respecting boundaries, even when they seem excessive. Remember that social isolation is often a very big component of CPTSD and can be one of the slower symptoms to actually improve in treatment. And lots of times, respecting the boundary that the person has in terms of isolating is important to a degree. Obviously, sometimes the isolation can become so impactful that it affects a person dramatically. And at those moments, a decision has to be made to intervene. But if a person with CPTSD just needs some space and needs to be by themselves for a little while, it's usually a good idea to let them do it. Next is avoid minimizing or comparing trauma. It's very easy for a friend or family member to become frustrated that people with CPTSD can't seem to get unstuck from their trauma. That the feelings that they have are so intense and so ingrained and so destabilizing. It's only human for people around them to become frustrated and, say, hey, get over it. This is life. Or, um, you know, you can do better, or make statements like that. And those are probably some of the worst statements anyone can make, because it not only invalidates their lived experience, but it minimizes it, and it can effectively compare their internal state to something that is not very significant. And that can cause them to become even more reclusive, to shut down even more. So instead of minimizing or comparing, avoiding value judgments is very important. And lastly, this goes without saying, is that staying calm during emotional dysregulation is really important, because when you become a part of their dysregulated experience, you oftentimes make it worse. So staying calm, or providing a level of stability during their most dysregulated moments, is very important. So helpful approaches include asking simple questions like, what do you need right now? Or offering choices instead of pressure. Remember, pressure is the enemy. Anything that sets up expectations of rapid change, or problem solving in the moment, like we previously discussed, is very destabilizing. So offering choices in a very laid back way can be much more helpful than applying pressure. And you want to encourage, but not force professional help. Consistent encouragement, maybe also by providing personal stories in a non-judgmental way of ways that maybe you've sought help and gotten help. If you've ever seen a therapist, that can go a long ways. And lastly, being patient with trust building over time is very important. This is a very long process. Trust is eroded in many ways in CPTSD, and it isn't reinstated overnight. So recognizing that is very important. So this concludes my podcast on complex post-traumatic stress disorder. I hope you all learned something here today and can use this information to either improve your own life or someone in your life who suffers from CPTSD. If you have any questions, comments, or maybe you're looking for some resources, please don't hesitate to send me a message. And I look forward to connecting with you again in the future with my next podcast.